Good afternoon. Thank you for coming in today. I wanted to discuss the next steps in your father's care plan. As you know, his condition has progressed, and we believe palliative care would be beneficial.
谢谢医生。可不可以解释什么是舒缓治疗？
Certainly, palliative care focuses on enhancing quality of life for patients with serious illnesses. It's not curative, but aims to alleviate symptoms like pain, dyspnea, or anxiety while providing emotional and psychosocial support.
舒缓治疗是控制病症，而不是治疗疾病本身，对吗？
Exactly. While curative treatments target the disease, palliative care works alongside those treatments, focusing on alleviating suffering and improving the patient's comfort. For example, even if your father continues chemotherapy, palliative care will help manage side effects like fatigue or nausea from the treatment.
明白。这个和临终关怀不一样吗？
Yes, there's a distinction. Hospice care is typically for patients with a prognosis of 6 months or less, while palliative care can be integrated alongside curative treatments or used in chronic conditions.
舒缓治疗可以处理哪些症状？
Common symptoms include intractable pain, cachexia, fatigue, nausea, and dyspnea. We also address existential distress or anticipatory grief, which are common in these situations.
疼痛是怎样处理的？
Pain management often involves a multimodal approach, including opioid analgesics like morphine or hydromorphone, adjuvant medications such as anticonvulsants or antidepressants for neuropathic pain, and non-pharmacologic therapies like physiotherapy or mindfulness techniques.
有没有一些副作用我们需要知道？
Yes, opioids can cause constipation, nausea, or somnolence. We proactively manage these side effects with stool softeners, antiemetics, and dose titration.
如果我爸爸有呼吸急促的情况，会怎样处理？
If the underlying cause is related to a chronic condition like COPD or lung cancer, we may use medications like bronchodilators or corticosteroids to open up the airways. In more severe cases, we may administer low-dose opioids like morphine, which can help alleviate the sensation of breathlessness. Additionally, supplemental oxygen therapy or non-invasive ventilation might be used if necessary, but we prioritize non-invasive options to maintain comfort without the need for invasive procedures.
他的胃口和体重减少怎样处理？
We focus on providing comfort measures like small, frequent meals and nutritional supplements if needed. However, we avoid aggressive interventions like tube feeding unless there's a clear benefit to the patient's quality of life. It's important to remember that the goal is comfort, not necessarily to extend life at the cost of suffering.
如果我爸爸有关于他的预后或者将来的问题，怎么办？
We encourage open communication. Many patients in palliative care have concerns about their prognosis, and it's important to address these honestly while being sensitive to their emotional state. We focus on helping them understand their condition, while also helping them make informed decisions about their care. This includes discussing advance directives and the patient's goals for care, whether that's maximizing comfort or maintaining quality of life for as long as possible.
我们可以做些什么来帮助他更容易过渡？
One of the most helpful things is to create an open, supportive environment where your father feels safe to express his concerns. Encourage him to talk about his feelings, whether it's about his illness, his fears, or his hopes for the future. We also recommend that families help with practical aspects like managing symptoms at home and understanding the medications he'll be on. Our team will provide guidance and support throughout the process.
这个治疗计划会不会涉及任何侵入性程序？
Not necessarily. For example, if dyspnea becomes severe, we might consider low-dose oxygen or non-invasive ventilation. But invasive interventions are avoided unless absolutely necessary for comfort.
我们怎样确保他的情绪健康？
We involve a multidisciplinary team, including social workers, psychologists, and chaplains. They provide counselling, help with advanced care planning, and address spiritual concerns. I know this is a lot of information to process. Do you have any other questions or concerns?
怎样知道是时候专注于舒缓治疗，而不是集中于治疗性治疗？
That's a very personal decision. It's usually a balance between the effectiveness of ongoing curative treatments and the patient's overall quality of life. If curative treatments are no longer providing significant benefit, or if the side effects are outweighing the benefits, that's often a signal to focus more on palliative care. We'll work closely with you and your family to assess the situation and guide you through that decision-making process. Do you have any other questions or concerns?
现在没有问题，不过如果之后有想到，我会再问。
Of course, please don't hesitate. I'm sorry you and your family are going through this, but we'll work together to ensure your father is as comfortable as possible.